Few days ago, the medical world in Nigeria were greeted with the sad news of the death of two doctors, and they were reportedly to have died of Lassa fever. Therefore, it became imperative that I do this video to enlighten you on everything you should know about Lassa fever. Greetings, ladies and gentlemen. This is your friend and brother, ODoctor. I welcome you in a special way if you are joining us for the first time. This is your favorite YouTube channel where I educate you about your health in the language that you will always understand, devoid of medical jargon. Today, we shall be talking about Lassa fever. Lassa fever. Most of us have heard of this fever, and this might just be another reminder video that this particular sickness is still with us and it still kills. All right. So, what is Lassa fever? Lassa fever is a viral hemorrhagic disease that it is caused by the virus called Lassa virus. Okay, it is hemorrhagic in the sense that it causes bleeding. However, it can also present without bleeding. A brief history: the virus was actually discovered in 1969 in a town named Lassa. That's where it derived its name. Lassa is in Bornu State, Nigeria, West Africa. So it was discovered in a woman named Laura Wine, a nurse, a missionary nurse that was taking care of a pregnant woman. She was taken to Jos, where she died, and even the nurse that was also taking care of her also died. This virus was later isolated to be named Lassa virus in Yale University, New Haven, United States of America. In 1972, it was then discovered that the multimammate rat named Mastomys natalensis is the major reservoir of this virus. Multimammate means it has several mammary glands, several breasts. So that is a very distinctive feature you should also look out for in case you see any kind of rat. Okay? So it was discovered that this multimammate rat is the major reservoir of Lassa virus. How can Lassa fever be transmitted? This virus is transmitted when this rat sheds the virus into its urine and feces. And when this urine and feces comes in contact with any food item or drinks or household equipment, you can get this virus through this means. All right? In other words, the ways of transmission of Lassa fever is through the feces and urine of these rats. Persons to person transmission can also happen through blood, urine, sweat, semen, or any fluid at all in the body. Sexual transmission has also been reported. What are the signs and symptoms of Lassa fever? In 80% of the cases, Lassa fever is asymptomatic. In other words, no symptom. However, in other cases, it can also present with 1. Fever, generalized body weakness, cough, sore throat, headache, bleeding from the mouth, from the nose, from the vagina, from the anus. It can also present with muscle ache, vomiting, and of course, chest pain. So how do we treat Lassa fever? Treatment of Lassa fever is dependent on time of presentation to the hospital. So if you see yourself presenting with these above symptoms, please kindly present as soon as possible to a good hospital. The reason is because Lassa fever, death from Lassa fever can be prevented if the person presents within 6 days of getting the virus. Is there any vaccine? For now, there is no vaccine that is protective against Lassa fever. How common is Lassa fever? About over 300,000 cases are recorded yearly, with a mortality rate of about 1% and about 15% in hospitalized cases. How do we prevent and control Lassa fever? Of course, get rid of rats from your homes. So many ways to kill a rat. Indeed, there are. So get rid of that rat. You can use rat poison, you can use trap, or any means available to you. Alright. Then 2, you cover all food items. Cover your drinks. Before you eat your food, warm them before you eat. Alright. If you're working in a hospital or healthcare settings, you always be on personal protective equipment, and regular hand washing can also not be overemphasized. Lassa fever can also mimic other diseases. Other diseases can also mimic Lassa fever. Example, Ebola, malaria, yellow fever, and typhoid fever. All these can mimic each other, including Lassa fever. So you may not be doing yourself good to assume that you have malaria and be treating malaria. So if you see yourself with any of these symptoms, especially in this season, please do well to present on time, please. Diseases can actually be prevented and controlled if everybody plays their role. Unfortunately, it doesn't happen that way. But then, let us do the most we can. Therefore, I enjoin you to share this video. Thank you very much for listening. I remain your friend and brother ODoctor. See you in my next video. Bye-bye.